Welcome to today's podcast. What if I tell you that your dog isn't pregnant even if it's nesting, it's producing milk, it's acting protective, and has unusual emotions? So, this is a condition that surprises many dog owners and sometimes worries them a lot. Pseudopregnancy, or also called false pregnancy. Today, we want to clarify what it is, why it happens, and when it's normal, or if it can become a clinical problem. And then, what would be the therapy? So, to clarify all those questions, I'm sitting here, I'm Dr. Francesca Zimmerman, and I welcome Dr. Mushtaq Memon, a former professor of reproductive medicine.
Thank you, Dr. Zimmerman. It's always a pleasure to be with you, and we'll be happy to discuss this problem of pseudopregnancy.
Well, so start simple. We start simple with what is pregnancy or pseudopregnancy. What is pseudopregnancy then?
But just like the name says, it's a false or pseudopregnancy, means it's not real pregnancy. So what it means is that when the animal's body does not differentiate between pregnancy and non-pregnancy. So even if you don't breed the female, she will go ahead and have the progesterone, and her uterus will have quite a few changes inside. And then she will show, or she feels like she is pregnant. So this is really where the trick comes in, that people start thinking, I did not breed my female, and why she's acting like she is pregnant. And then when it comes to close to the end of the duration of 62 days, she behaves like she is going to deliver puppies. So adopting shoes, adopting toys, so things like that. And it becomes very disappointing for those people who have done breeding and have bred their dog. They are just waiting to have puppies come, and they never come. They never arrive. So this is really a pseudo-pregnancy. It means that the animal is not pregnant, but behaves like she is pregnant.
But why does it develop then, even if they don't mate?
Yeah, as I mentioned, that the main hormone is progesterone. The progesterone keeps this animal in diestrus, which is as long as a pregnancy. So even if you don't breed a bitch, she will have that high progesterone for all the duration. Then there's another hormone called prolactin. Prolactin plays part in it. It's a natural phenomenon, if I say that. I go even so far saying this is a normal thing.
So, can we tell that pseudopregnancy, can get dangerous, or is it just normal?
It is really, I would say, it's a normal physiological condition with different type of, outcomes. But all animals go through pseudopregnancy if they are not pregnant, But as I said, the showing of the behavior, the mammary gland enlargement, those just vary from one dog to the other.
But it's not dangerous then?
No, it's not dangerous at all. In fact, if people are really worried about it, then I think we need to do some diagnostics. And some of the commonly diagnostic tests is ultrasonography. So, veterinarian would see under the ultrasound, the uterus is full of fluid, it's enlarged, but there's nothing in it.
Is there another way that vets would distinguish between pregnancy and pseudopregnancy?
You can have a radiograph taken, X-ray, and if she was a pregnant dog, you will see some puppies there, but if she's not, then there won't be any puppies.
Mm-hmm. And when do we have to treat pseudopregnancy? Or do we even need to treat
it? This is a normal phenomenon. Pseudopregnancy is a normal thing, happens in every non-pregnant young bitch. It's just that people get concerned when, bitch has never been bred, and then she shows the signs of pregnancy. Now, the only abnormal thing is that some bitches will show this behavior very intensely. They will be very intense in, as I said, showing the behavior of adopting shoes and stuff and toys and nesting behavior. So this is really a normal occurrence unless it becomes really difficult. For example, the mammary glands start accumulating milk, So sometimes those mammary glands become enlarged to the point that female becomes uncomfortable and becomes very warm. I think those are the conditions that we need to probably have the doctor, the veterinarian, look at it and see if there's anything need to be done. People recommend that you have to have some cold packs around the mammary gland so that enlargement could go down, but do not want to milk it out, because that will stimulate the mammary gland and she'll be producing more and more milk. You have to get the female out and exercise, which is a good thing for the female, so that she can, have some more activity to resolve the problems of mammary gland enlargement.
Mhm. And about the protective activity, do you need to address that as well, or don't you have to address it?
It's just that even if they're doing it, it's a pseudo pregnancy, let them enjoy the shoes and toys. It's not really any problem. But, again, try to distract them, take them out, take them to the park and let them play with other dogs. And I think that's the best therapy for them, But try to stay away from any kind of, antibiotics and things like that, because there's no treatment is really needed. Only you're trying to treat the symptoms. The intensity of that behavior is the one which we are trying to control. So, give her, tender love, and then let her pass through that, because she will come out of it, within a few days.
So I think we heard the most important things about pseudopregnancy. So I quickly summarize. Pseudopregnancy is a hormonally driven normal condition in female intact dogs, and it mimics pregnancy essentially. So in most cases, pseudopregnancy resolves on its own, and it can be that it becomes clinically relevant, but you can manage it with behavior management of the dog. So thank you so much, Dr. Memon, for being here and sharing your insight. Also, thank you for you out there for joining us and being here with us. If you found that video helpful, especially for other dog owners, then please go ahead and share it, subscribe and like. So see you next time.
Thank you. Bye-bye.